Hi, everybody. John Younger, Assisted Living Locators, here with my show, 5 Minutes With. I'm thrilled to have Jim Feldman from Care Dimensions on the hot spot today. So, Jim, welcome to 5 Minutes with Jim Feldman.
Great.
Nice
Thanks,
to see
John.
you.
Hi, everybody.
Why don't you
Thank
tell
you,
us a
John.
bit about what you do with Care Dimensions?
Sure. Thanks for inviting me on. That I'm happy and proud to say that I've worked for Care Dimensions for over 10 years now. And, it's a great organization. Like I said, I'm proud to work for them. And my actual title is Provider Relations Coordinator. Now,
What does that mean?
You can take, it's an interesting title, but basically my role is to educate folks, families, referral sources such as nursing homes, assisted living communities, physician practices, the general community, and just educate them about what we do and how to access our services and get our support. Care Dimensions actually was founded 40 years ago.
Wow.
As a volunteer grassroots organization, has grown very much significantly in those 40 years to now become the largest hospice and palliative care organization in Massachusetts. Beyond just hospice and palliative care, there's other services we provide as well. We actually were founded, some of you might be more familiar with Hospice of the North Shore. We eventually changed our name to Hospice in North Shore, that people could realize we weren't just demographically set to the North Shore. And then in 2014, we changed our name again to Care Dimensions, realizing the different needs of the community, the folks we served out there, and the new services we were starting to develop, and just how hospice and palliative care was expanding, and palliative care becoming a much more important in the eyes of healthcare service to provide. We just felt we needed to, have a name that didn't just box us into one particular type of service. So,
Right.
But our main service is hospice and palliative care, helping folks when the time is right in their lives to seek another type of, and I'm going to call it a plan of care and way of living with an advanced illness. And we offer a full continuum of services. We actually can be involved with a family and a loved one or an ill person for several years. And one of the biggest myths and misconceptions about hospice, and I'm sure you're familiar with many of them, is that, oh, I'm going to go into hospice and I'm going to die immediately. Or, because there is a eligibility criteria that says you need to have a diagnosis with a life expectancy of 6 months or less, people feel I'm going to die within 6 months. However, we're here to actually provide quality of life and dignity. And it's not really, hospice is correlated with death, but it's really about living.
Right.
And it's whatever time you do have left to live, having a quality of life, dignity, pain-free, symptom-free, having control over your life, spending more time with your family, quality time with your family. A lot of people think, oh, I'm giving up hope. Well, it's not. It's shifting the hope. It's a different type of hope. It's hope for quality and a good life.
Right. So let me expand a little bit on your interesting point that you made is the way that a lot of folks view hospice, and they look at it as, for lack of a better word, a death sentence.
Yes.
But to your point, and very important for people to know, is because you take advantage of hospice or palliative services, it doesn't mean that you're going to be passing away anytime soon. In fact, people graduate off of hospice, right? At times.
That graduate, people will stabilize and they can't qualify anymore because they've gotten better. And there's actually research done. There's studies out there that people live longer with these illnesses when they're on hospice services than not on hospice services. And we've had people on service. I know of people that have been on close to 3 years. So it is possible. It's not, like you said, a death sentence. We're not cloak and dagger.
Right.
Coming in. So, because it's like I said, it's about living. It's not about dying.
Right. So it's important for people to know and understand that it's for a better quality of life, no matter how
Yes.
long you may have.
Right.
Now, where can these services be performed?
We provide services in multiple places. I kind of go through the 5 W's of hospice: who, what, where, when, and why.
Okay.
Is kind of something I like to do. And basically, who is anybody who is diagnosed with a serious, life-limiting, advanced illness, and has decided that rather than seeking treatment anymore and curative treatment, they want to focus on comfort and be pain and symptom free. And that can be any type of terminal diagnosis. A lot of people, another misconception, thinks it's just people with cancer. Before I joined the organization, I was one of those people. I felt that anyone in hospice had cancer and they were going to die within 6 months. And I know there's plenty of people who feel the same way, but we run an average daily census of close to 1,000 people, and 40% have cancer diagnosis, or around 40%. The next highest diagnosis is dementias and Alzheimer's disease.
Yeah.
That's very high. Cardiac, CHF, respiratory illness, COPD, kidney, end-stage renal disease, ALS. It runs the whole gamut of different types of illnesses that a doctor could say has a terminal diagnosis.
Right.
And
Go ahead. Sorry.
And it's interesting. One of the criteria by Medicare and most insurances is that you have to have a diagnosis of 6 months or less to live. No doctor has a crystal ball. No doctor follows textbook. So that's why it's a moving target, and it doesn't mean that you will definitely be passing away within 6 months.
Right. And people can have your services either in their home or in an assisted living.
Right. Yeah. The where is home, nursing homes, assisted livings, group homes. We've done folks who are homeless. We've had people who are homeless on service with us.
Wow.
Yes. We will somehow make a way to take care of them. In the hospital, if you're contracted with the hospital, sometimes people will stay in a hospital. We, from Care Dimensions, are fortunate enough, we're one of the few organizations that have inpatient level hospice houses. We have 2. We have the Danvers house, the Kaplan Family Hospice House, has been since 2005, and that has 20 private suites. And in 2018, we opened our second hospice house in Lincoln, Mass. It's on the Waltham-Lincoln line, with 18 private suites. And that's the same as being in a hospital. That's for high level of hospice care. And folks can go there to get some people who are on service with us might go from their home or in assisted living and go there if they're in crisis management and they can't be taken care of at home anymore, get stabilized, go back to their prime residence, or go there for end of life.
Right.
It's round-the-clock nursing. You need round-the-clock nursing care, medication management, monitoring of symptoms, and that's the inpatient level of care. And Care Dimensions, like I said, is fortunate. Out of the 5 inpatient level hospice houses in Massachusetts, we own 2 of them. So we're very proud of that.
Great. And in your service area, where a lot of folks come from?
Yeah, we cover over about 100 cities and towns, eastern Massachusetts. right up to the New Hampshire Maine border. So we're up Cape Ann, Merrimack Valley, you know, right up there out to Metro West, maybe as far out as Framingham, Natick, up towards Acton, Littleton, that way up towards Merrimack, down to Metro, all of the cities, all of Boston, greater Boston, Metro North, Metro South, down as far as Braintree, Dedham, Canton, and that pretty much is our geography.
Great,
So,
right. I'm a big fan of you, Jim, and big fan of Care Dimensions. If a referral source or a healthcare worker or family need to do a referral, what's the best way to accomplish that? To get a hold
well,
of you?
anybody can make a referral.
Okay.
Anyone can make, family member can just call into our offices. The number is 888-287-1255. You can speak to your primary care physician, and your doctor can make the referral. If your loved one's in a nursing home, you could talk to the folks at the nursing home, and somebody from the nursing home can make a referral. If you're in assisted living, one of the nurses at the assisted living. So, if you're in a hospital. So if any family member can bring that up and ask for a referral, or they can call themselves. And then we
Okay.
just need to get a medical order from the doctor, and we'll take it from there. And we're
That's great.
24/7, 365 days a year.
Wow.
We've done, actually, in 2019, we responded to over 20,000 calls in
Wow.
the evening, made 18,000 above and beyond the regular routine visits by our nurses, social worker, chaplains, aides, volunteers, which is part of the interdisciplinary team. We made 18,000 additional calls at night, through the evening, through the early morning, for people who needed us to come out and see them in a crisis situation, or for support for family or pronouncement. So we're 24/7, 365 days a year.
Oh, terrific, Jim. Thank
And
you.
we also,
Go ahead.
oh,
No,
I
go
just
ahead.
want to quickly mention about,
Yeah.
palliative care.
Oh, okay. Yeah.
Palliative care, which is, kind of, you don't need that terminal diagnosis, but it's a consultative service for pain and symptom management. Our Bertillon Center for Grief and Healing, which is bereavement support for anybody, whether you've been on service with us or not. We have workshops, support groups, private consultations. Just get that information on our website, caredimensions.org. And the last service I just want to quickly talk about, something completely separate than hospice and palliative care, is we started in April Home MD program, which is
Oh,
home-based palliative care for
okay.
anybody over 65 who's getting too frail to be able to get out and go to a physician anymore. It's home-based visits. We have a doctor, Dr. Mark Messenger, and 2 nurse practitioners, not hospice related, completely separate from our hospice and palliative care, but it's doing home-based primary care for elderly, senior, well, not elderly, over 65 folks who are just getting chronic conditions and a little too frail to get out.
Yeah. No, that's a great new service. I remember
Yeah,
you.
we're proud
Yeah,
of that.
that's a
Very
great new
happy with that.
service.
Yeah,
We may have to expand on that at a later date.
we could
Yeah, we
do a
may
whole
need to
thing on
expand
that.
on that at a later date, because that's an important part of what you do as well.
Yes.
Um, hey, Jim, thank you so much. I know I personally have had family members in the Kaplan House, and Care Dimension
Hmm.
does an amazing job. I've also had experience as a volunteer at Care Dimensions many years
That's
ago.
right.
Kind of how
Thank
I
you for your
started
services.
the thought process of what I'd be doing with senior living. So
Yeah,
I certainly appreciate it, and I appreciate your time coming on, Jim. And I'm sure our
you're
listeners
welcome.
enjoyed you. And have a wonderful week.
You too. Thanks for having me, John.